So strategies we've talked about: medication reconciliation, adequate history taking, patient counseling and pain therapies. I cannot emphasize enough how important it is to talk to the patients. Cut down the number of drugs. Do the weed and feed, right? Cut it down. What do you need this for? And increase pharmacist involvement. So other strategies is to make mistakes more visible. So think of it like when the bank robber takes off, it's really visible who had the money, because they've got the exploding ink. So think of it, what can you do, or the bathroom key that's got a piece of metal on it that's this big. You have to make it visible and like really obvious. And then think of things failing to safe. If it's going to fail to the option that won't hurt the patient. So we look at unit dose, unit of use, and then again, measuring devices. So here's an example of really profound lookalikes. One is 20 per 1 and one is 20 per 5. And then this is after they redesigned it. The concentrated is really more bold and it looks way different than the non-concentrated. But personally, I would be buying the right one in a unit dose cup. And now they do make unit dose in the other one as well. But for home use, that's a little awkward. But nothing says you can't do that. Now, in case you fell asleep, time to wake up. Yay. This is one of the most useful tools in patient safety. This tells you if you're going to change something, how should you change it? And what kind of interventions can we make, right? So we can do some education. That's not bad. It's not saying education is evil because it's at the bottom of the list, but education and information has a short half-life. People go on vacation. People forget. They don't have the information, etc. So it's not very robust, but it's sometimes very necessary. So don't get the idea that it's not necessary. But as we go up the list, it gets stronger and stronger. Rules and policies. You're trying to make organized systems, right? Then you go up the list, checklists and double check systems. The answer to medication safety is not double checking everything. In fact, a check only catches 85%. But it's better in some instances and very selectively and done independently. An ISMP candidate did a beautiful job explaining what independent double checking is. It's like being blinded and doing the order all by yourself, and then this person does the order and then they meet at the end, right? Don't get poisoned by the previous information. So standardization and protocols, thoughtful automation. I won't tell you that all automation makes it safer. Some in fact makes it worse. But thoughtful, well-designed, human factors enabled or designed around the human automation is really a very, very good strategy. Think of barcoding, think of RFID, those kinds of things. And the best of all are forcing functions and constraints. And actually, above that is eliminate. So this is produced by the National Center for Patient Safety, and we use this all the time because when you're on an RCA team, you're on your med safety team, we could do a couple things. You could put out a newsletter article, and then you can standardize. So we're doing that like with half tablets. So we put out a little blurb, people understand why we standardize, and then we standardized. Many of these things have happened to many of us. So think about what you would want to share with others and have a new enthusiasm for going forward and changing the world. Because when I went to Saudi Arabia in 2008, I saw the anticoagulation goals from Joint Commission, which was based on the ISMP self-assessment for anticoagulation, which I worked on with my clinical coordinator, which was because in 1990, my boss believed in pharmacists. And he believed in us, and we changed. I figure out in a little teeny way, we helped change the world because now around the globe they're thinking about anti-coag safety. So I called him up. He's working at another job, and thanked him for his trust in us as a system. It was very cool. So go out and change the world. Thank you.